acknowledge the Wajok Noongar people as the traditional owners of the land which we are meeting today. I pay my respect to the elders, both past and present. Good morning. So today I will be teaching you on how to perform a bed wash on a patient in a hospital setting. So a bit of housekeeping. Toilets are outside. If there's any emergency, we will follow the hygiene protocols and procedures. Hi, my name is Edbren, and today I will be teaching you how to perform a bed wash on a patient in a hospital. And then we've got Chrissy as my student today. Just before we start, a bit of housekeeping. Toilets are outside. Fire exits. I'll be the fire warden today, and yeah, I'll start now. So the first thing that we needed to do when we're doing a bed wash is that we make sure that the patient is actually comfortable with it. So I will check if the patient's okay. Hi, my name is Edwin. I'll be your nurse for today. I'm gonna give you a bed wash. Just before I proceed, can you please tell me your name and date of birth? And once they've confirmed their name and date of birth, and is that okay if I perform the bed wash now? I'll get someone else with me as well to assist me. But for now, for this demonstration, I'm going to do it by myself, and then I'll get Chris to show me how to do it, and then I'll give feedback along the way as well. So the first things first, we need to make sure that we've got all of our equipment. So towels, gown, 2 flannels, water and bowl with soap. Yeah. So the first thing that I needed to do, and normally we have a skip, but today we don't have a skip, is to raise the bed to the level of my hips to make sure I'm following manual handling procedures. So now I'm happy with the height of the patient. I'll make sure to respect patient's privacy and dignity. So I'll put a towel in it. It will be a bit cold when you do this. So when you do it, please make sure that your patient's covered. So normally the old clothes, the towels, the used towels and used flannels will be in a skip bin. So I'll use this. Fantastic. Now I'm going to perform hand hygiene. Put my PPE on. For this instance, we're just gonna use a pair of gloves. And then you change it if it's soiled, if it's visibly soiled, or if you touch any bodily fluids. Okay, so this time I would unroll my towel, put it on one side, wet my flannel. I'll start with the face. So the inner canthus of the eye, the inner corner of the eye, and out, one swipe, and then the other side. One swipe, then the head, the ears, yeah, the hair, the neck, all of these areas that needed to be cleaned, and the ones that are mostly moist areas, we need to make sure that we're getting that. Okay, once you've done that one, I'll have my third towel to dry. And I'll use this one for warmth as well. Now we're gonna go down the patient's arms. You'll start from the fingers. Make sure you cover everything and you clean every crevice of the hands and fingers. Then we move on to the arms. The reason why for this is to promote circulation. Then the armpits. And as you go along the way, you dry as well. Then I'll expose the top bit. Clean the chest. Then dry. And same goes for the other arm. Then I'll move on to the lower extremities. So the legs. Make sure that you get all of the, like in between the fingers, toes. Yeah. Then dry. And you do the same on the other side. Then I'll get Chrissy to show me how you would do it. So the back one, you need a second person to do it. So you ask the patient to cross their arms over the chest. Yeah, and then you do the manual handling. Okay. Yeah, fantastic. And then we'll cut. Fantastic. You can pause now, sister. Now what I'm going to do is I'm gonna get an assistant to help me move the patient. So in this instance, Chrissy will help me to move the patient using our manual handling techniques. Okay, so if you can put your arm over the patient's shoulder, this one, and then the hips as well. I'll ask the patient to bend their legs, and then at the count of 3, we'll move the patient. 1, 2, and 3. Fantastic. Then I'll use this towel to wash the patient.
Did they use also the glove?
And then you dry. Then I'll use another disposable stuff for this, but for now we're not going to show that in this video. And then once we finish, I'm going to ask the patient to roll back. And then this is the time in the hospital that you actually change all of the bed linens as well and the sheets. But for now we're not going to show that. And then at a count of 3, we're going to move the patient 1, 2, 3, roll until you're back. And then I will get the patient dressed. Before that, we are going to moisturize our patient, check the patient's skin integrity, any pressure ulcers that are forming. So we need to perform a comprehensive skin integrity check. After we've finished with this, the bed wash, patient's moisturized and skin integrity has already been checked. We're going to put the patient's new pad and yeah.
Can you charge this one, please? Thank you.
Dispose of your used towels. Put some linen, put a flat sheet and a blanket with your patient. Make sure that they are comfortable. Put the patient's cold bell next to them and check your patient after an hour. Last thing that you needed to do is to make sure that your patient's comfortable. So you put on a blanket over your patient. Make sure that they're comfortable. First, what do we need to do, Chris?
Yes, is to introduce yourself to your patient, to your client. My name is Chris, and I will be doing a body wash for today. Is it okay with you?
Yes, that's okay.
Okay, first I will do my hand hygiene first.
I'll do the same thing.
Put on your gloves. So I'll gather all the materials we needed for the body wash. We have here the towels, flannels, and assuming that we have those disposable wipes with, and the water and the basin. So first I will put the first towel. By the way, sorry, we need to put our
Fantastic. Manual handling.
manual handling thing part. So same level with my hips.
Very good.
It will take longer. At the top. And then there you go. So I put my towel with the first towel. And then there you go. And then I will get my flannels.
So, Chrissy, you need to get another towel for the patients.
Oh yeah, sorry, I forgot
yeah.
to put another towel to maintain privacy
Correct.
and dignity with the patient.
Correct. And then just remove the old gown,
And
patient
the
gown.
old gown. Put it in the skin. We just assume that it's the skin. Now we will start doing the body wash first. I will wipe right under the eye. There. Same goes to the other side.
Very good.
And then here. To the neck. Then we go next to the arms. So first, we will wipe first the hand, then goes up until the armpit. We are doing this one to promote circulation.
That's good. Yes, that's correct.
Same goes with the other side.
So what do you need to do, Chris, once you've finished that arm? Just dry it.
Yeah, just dry it like this.
Correct, yeah. Or get another towel.
Or get another towel. Or the third towel.
Correct, yes.
Then same goes with the other arm.
That's correct, yeah.
So we're next to the chest part. So we're gonna grab this one. And dry with another the towel. Then privacy again. Then next, right after this one, we'll go to the private part.
So legs first before the private parts.
Legs first. Sorry, I forgot. So we'll go down the leg part. So toes. The same goes with the other part. The leg. And then I dry it. Then next will be the private part. So with this one, I will use the disposable wipes. So given that, assuming that this is the disposable wipes, so
And then I'll cut this.
ready.
Good.
So now, so I need another a partner to do washing on the back part of the patient. So first, we should let the arms crossed before turning on the patient. Then my partner should, and then we should bend the legs. Then
Show them
there.
at the count of 3.
And count 1, 2, 3. There. So first I will wipe the back part.
So Chrissy, what are we assessing on this patient if we're doing the back?
The skin integrity.
So we're checking for skin integrity, correct? And what else?
And pressure area presence in the butt part. As we call it.
So any bony prominences, we're
Yes.
checking scapula, spine, sacral, heels and toes. Fantastic. Good job.
Then we need to use the disposable wipes for this one. Throw it. Then right after this, so we need to dry the patient before turning back. moisturize it.
That's correct.
Need to moisturize it with sorbolin.
So why do we moisturize the patient's skin?
Oh yes, for the skin integrity of the patient.
Very good.
Then we need to put on the gown.
Thank you. So some hospitals have got the snappy things, so you'll use that. Whatever you have in your facility, you need to use them. Yeah. And then the last little bit is to
Now we will put on. Now the patient is already comfortable with the gown, and you will put down the bed.
we'll just remove the towel first.
So remove the towel. Sorry.
That's okay. This is your first time doing it, so well done, doing really well.
Then
Put a blanket on.
okay, we need to put on the blanket.
Thank you.
Putting the patient down. So that's all for it. And the call bell. Put on the call bell.
Next to the patient, and that concludes how to perform a bed wash on a patient in the hospital. Thank you. Do you have any question, Chrissy?
So I'm good. Thank you.
Any feedback?
So far, though I'm struggling with the towels, but it's okay. I've learned a lot.
Oh, you did really, really well. Well done. Thank you. Thanks for your time. Thank you. Boom! Thanks. 5 minutes. Consider the patient's privacy, dignity. We need to make sure that we have the consent for the patient before we do any bed wash.
I was able to provide holistic care with the patient, making them comfortable and making them at ease while they're staying. And then, aside from this, we can provide health assessment technique. Like we came to notice that regarding their skin ability, their mobility, and general health issues also. And we came to communicate them that's what they need as being confined in a hospital or wherever facility they are. Able to communicate well, like doing holistic care, communicating them with respect and dignity, being therapeutic driven, and time management and efficiency in doing the task, because and being giving with them dignity at all, because that's what they need. And apart from this, back in our country, it was way different in handling bed washing techniques. And since I am planning to do my registration here in Australia, it helps me a lot to gain some skills and knowledge with the nursing profession here in Australia. And I'm very thankful that I was been able to perform this kind of technique, as we can use it everywhere, any facility, and even hospitals and aged care facility.
And that concludes our bed washing procedure on a patient in a hospital setting. Thank you for your time.